Hello, it's Dr. Jo. We're going to talk about dry vaginas today, or doctors tend to call it the genitourinary syndrome of menopause. That's because it's not just about a dry vagina, it's about leaky waterworks as well. And these are quite difficult things to talk to the doctor about. Wet knickers and a dry vagina, that's a bit back to front, isn't it really? But let's just look at the waterwork side of things. Stress incontinence, that happens when you realise that you have leaked a bit of urine when you laugh, you cough, or you jump. And urge incontinence is you need to rush to the loo, particularly when you get home. You get a key in the door and then you really have to go. These are symptoms brought about by no estrogen in the urethra. And the urethra is the pipe that goes from the bladder to the outside because it has estrogen receptors in it in the same way as does the vagina. So let's think about those local estrogen receptors and what we can do to stimulate them. Well, surprise, surprise, we can give you estrogen. And one of my favourite phrases is, fill that vagina full of estrogen. Even women who've had an estrogen receptor breast cancer and have finished their treatment can have vaginal estrogen. It's safe for all and it improves not only your vaginal health but also symptoms of stress and urge incontinence. What's not to like? It can be given in the form of pastries and cream, and if I see patients, I actually often say use it every night for 28 nights and then twice weekly. And this can be given in addition to actual hormone replacement therapy. And I mean by the patches, the tablets, the gels, and whatever that you might be taking. But what we also have to remember is that dry, sore vaginas aren't solely due to vaginal atrophy. So dry, sore vaginas can be caused by persistent thrush or candida, perhaps with undiagnosed diabetes. And there might be something called lichen sclerosis. So if there's any doubt, I often think it's important to have an examination. And that's really difficult if you've plucked up courage and it's a GP that you're going to see that you don't know or you feel uncomfortable about. But it is important because all of those things can be really easily treated. There's a book that I advise my patients to get. It's called Me and My Menopausal Vagina. It's a really good read, plus the fact it's bright yellow. So it's good to read in public because people then turn to see, oh, what she's reading, and then look away really embarrassed. So when doctors ask you about the vagina being dry, it's really important to say that it is and it's uncomfortable. Is sex sore? Often I say, is sex sore or is it dry? It might be a bit dry. Or no, sex isn't a problem, but we use KY jelly. Why? When you can have some estrogen? The other thing is, there's lots and lots of lubricants that you can get. And I often say to patients, just go and try them all, and then you can find the one that suits you best. And I'll be talking a bit about vaginal lubrication that you can buy when I talk about non-hormonal medication, because it is important and there's lots and lots on the market. Okay.